Welcome to episode 2 of the VA Desert Pacific Dispatch. This is a podcast that we provide for the veterans that we serve in the VA Desert Pacific Healthcare Network. We serve Southern California, Arizona, and New Mexico, and I'm excited to welcome everyone to our second episode. First, before I begin today's podcast, I would like to encourage all of our listeners to like and subscribe the Phoenix VA Healthcare Network YouTube channel. This is currently where we're housing our podcast. So I'd like to encourage everyone to like and subscribe this podcast on their channel. So I'm very excited. Today's episode, we are going to discuss VA tele-emergency healthcare services. Veterans can actually now receive high-quality emergency care services from comfort of their home. So today we have a special guest. We have Dr. Bahari. She's going to provide us some insights into emergency care services. Welcome to the podcast, Dr. Bahari. So before we begin, Dr. Bahari, she began her career at the Phoenix VA in 2019 as a specialty telehealth director. Dr. Bahari is a double board certified endocrinologist with a passion for rural health, health equity, and digital health. She sees rural patients throughout Phoenix and northern Arizona. Welcome to today's podcast. Can you tell our listeners a little bit more about yourself?
You did such a nice job introducing me. I would just say that I'm really excited to be here. And if I could say a shout out to all my patients that I see throughout northern Arizona. And then a fun fact about me is I just got into rock climbing last year. So I really like those adrenaline highlights kind of things right now.
So can you tell us, how you first got involved in tele-emergency healthcare?
Yeah, definitely. So I'll take you back to March 2020. I had a grandfather who was a patient at the Northern Arizona VA, and he was having some nausea and vomiting and some difficulties, but I couldn't convince him to go to the emergency room. So when I called him and was checking on him, I was like, can we at least call the VA and just see if there's anything that they can do for you? And so he was agreeable, so we called the VA, and when we called, they had offered to have a nurse call us back in 4 to 6 hours. And I was really concerned about him. And I was like, 4 to 6 hours, it's a while to wait. I tried to convince him to go to the ED, and he said no, maybe in the morning. So the next morning, I tried to take him to the ED. He was willing to come with me at the time I was working at the Phoenix VA. He was willing to come to the Phoenix VA. We took him there. He was able to get help, seen in the emergency department. But during the whole process, it was pretty frustrating that I had a hard time getting him help, given that he didn't feel well enough to go to the ED, even though I knew he needed to go. But then I couldn't get him help over the phone. And I know the VA tries so hard to serve our veterans when they need that help, but it was clear that something needed to change. So after that, I went and talked to the leadership at the Phoenix VA, and I said, right now, especially with the pandemic starting, we have a real opportunity to create a service where patients can call, and if they're really ill, we can provide care right away to them. And maybe we can provide emergency medicine support by putting emergency medicine physicians, PAs, nurse practitioners, and even specialized RNs or nurses at that point of contact when the veteran calls in. So that's kind of what started everything. We started with tele-COVID. So if a patient called with COVID symptoms, we wanted to really keep them out of the emergency department. They didn't need to be there, and we managed them from home. Then we found that a lot of veterans were saying, we really like the service. Can I call you for other things? So we expanded it to tele-urgent care, and now we've expanded to tele-emergency care.
Thank you so much for sharing that story. And how can a veteran access these services from the comfort of their home?
So that's a great question. What they can do is call their local VA or VA Health Connect, also known as Clinical Contact Center. The phone number for us is 1-877-252-4866. And then they can go ahead and select 2. When they get the person on the other end of the line, they just need to share what symptoms they're having or what concerns they're having, and they'll go ahead and triage them to determine, do they need to go talk to a nurse, or do they need to get routed to our tele-emergency care program. Once they get routed to the tele-emergency care program, they're seen by an emergency medicine nurse, and then based on their symptoms and things like that, they'll go see a tele-emergency medicine physician, nurse practitioner, or PA, who will go ahead and try to resolve their issues that they're having. We actually resolve about 2/3 of cases without patients having to come to the emergency room, which is amazing.
So I'm a veteran myself. So let's say I decide to call the clinical contact center because I'm not feeling well, or I'm not sure if I need to go to the emergency department. Can you kind of walk me through a typical call, how that will be?
Yeah. So when you would call, you would talk to somebody on the phone who's going to ask you a lot of questions. How are you feeling? Are you having a fever? All those kinds of things to kind of figure out where you're at. And then and you'll get kind of triaged into different categories based on how urgent you need to be seen. If you have really concerning things, they'll go ahead and connect you with an emergency medicine trained nurse who will further triage you. And then once they're done, you'll go ahead and talk to an emergency medicine trained provider like a physician, nurse practitioner, or PA. When they talk to you, they prefer to talk to you over video if you have that bandwidth or if you have that capacity. And that would depend on you having a smartphone, a tablet, or a computer with internet and a camera. If you don't have that, they'll still talk to you over the phone. They'll go ahead and see what's going on and see what they can do to help you. If it's something that they can manage from remotely, meaning while you're at home and things like that, they'll go ahead and give you that guidance. But if they feel like after assessing that you really do need to be seen in the emergency department, they'll go ahead and advise you to do that. And in the meantime, make a call to either the VA emergency department or whatever emergency department that's closest to you and make sure they're aware that you'll be coming. The benefit of that is that we can go ahead and expedite your time in the emergency department so you're not waiting as long. And maybe they can even put in things like blood work or x-rays and things like that so you can get that done while you're waiting to be seen.
So let's say I'm feeling really sick and let's say a family member, can they call on my behalf if needed?
Absolutely. I think it helps if they're calling and you're there with them. So if it's a family member that's at home with you, that's the best situation. But even if it's a family member that's not at home with you, they can easily have you on the phone and call at the same time so that whoever's talking to the family member also can talk to you.
And do you have any advice? Let's say I'm not feeling well and I needed to prepare for a call. Is there any suggestions that you'd offer to veterans on preparing for a call?
Yeah, that's a really great question. Having your medication list or the medications that you take by you so that they can ask questions about that. If you have a blood pressure cuff, a thermometer, and maybe even a pulse oximeter, you have those at home, having those available so that they can ask you to take your blood pressure or see what your heart rate is or things like that. That helps them make an assessment would be really helpful.
And do you have any success stories that you can share with our listeners?
I have so many. My favorite one is of a veteran who lives 4 hours away from his closest VA emergency department and 60 minutes away from his closest community emergency department. And when he called in with his complaints, he was able to get seen by a provider on video. They went ahead and prescribed him something that he was able to pick up from his local pharmacy 20 minutes away. And the feedback I got from him was that it was 45 minutes from when he first made the call to when he picked up the prescription at his pharmacy, which for me is unheard of. If I got that kind of care, or, I always say if my mom gets that kind of care, I would really be really proud of that.
And let's say I'm seen, I'm triaged, they do an assessment, and let's say the physician says, just stay at home. Is there any aftercare that's provided, or how would you continue to monitor the situation if a veteran decided, or they stayed home, or they're the comfort with a loved one?
That's a really great question. We have a few ways. One, and it kind of depends on what you have going on and how soon you need follow-up. We always try to connect with the primary care providers for that patient and make sure that they have a follow-up with them at the minimum of a phone call. Depending on what it is, or if it's something that we feel like we really need to follow up with them, we actually have a way to track our patient so that we can reach out to them, the next day or a few days later to just say, hey, Mr. So-and-so, how are you doing since the last time we saw you? The other thing is we do order things like labs and x-rays and other types of imaging. So when we order those can be done on an outpatient basis. And then someone from our team will call you to give you the results and give you further guidance on what to do.
And how has the service helped with like the emergency departments of the VA and veterans being seen in the emergency department, or, maybe you make a decision, you make the call, you realize you don't have to do it. How's that helped our veterans overall?
That's a good question. All of us, I'm pretty sure all of us can agree that going to the emergency department is not always the best experience because you don't know how long you're going to be waiting to be seen. It's a lot to even just go and go there. So the benefit of this is if you don't have to be seen in the emergency department because you're not having a real urgency, we can take care of you and at the same time decrease how long people have to wait in the emergency department to be seen.
And at the end of every episode, we always like to include a call of action for our listeners. Is there anything that you'd like to provide a call of action to our listeners?
Yeah, I would just say, my experience, veterans are always afraid to ask for help or afraid of being a burden on others. I would say, please don't worry about that. If you're not feeling well or you feel like you need help, please call us. That's what we're here for. We want to help you. We hate the idea of somebody not calling us when they need help or not going to the emergency department when they need help. This is a great intermediary step. If you're like, I don't know if I want to go or I don't want to go, at least call us and let us try to help you over video or over the phone.
Well, I really hope you enjoyed today's episode of the Desert Pacific Dispatch with Dr. Bahari, and she provided some amazing insights into the VA teleemergency care services. And this service is available to veterans nationwide now. It just recently was announced. So I just want to remind everyone that they can like and subscribe to our podcast through the VA healthcare system, to the Phoenix VA Healthcare System YouTube channel. And so I'd like to thank our listeners, their families, and caregivers for tuning in. And I would especially like to thank the Phoenix VA Healthcare System Public Affairs Office. Their support has been amazing throughout this podcast, and I really appreciate their support. If you have any topic ideas, please leave comments below, or you could send us an email to VISN22PAO@va.gov. Till next time, I hope everyone has a wonderful day. Thank you so much.